Did you know that lung damage is more prevalent than you might think? Stay tuned to discover some shocking statistics about lung health that you can't afford to ignore. Today, we're diving into the serious issue of lung damage and its significant effects on overall well-being. Let's explore this crucial topic together. Lung damage can stem from various factors, including smoking, exposure to pollution, and respiratory illnesses. These can wreak havoc on our respiratory system, leading to severe consequences if left untreated. It's essential to be aware of the signs that indicate potential lung damage to take proactive steps towards better lung health. Number 1. Shortness of breath. Shortness of breath, also known as dyspnea, is a common symptom associated with lung damage. When the lungs are damaged, their ability to efficiently exchange oxygen and carbon dioxide is compromised. This can happen due to various reasons, such as inflammation, infection, chronic obstructive pulmonary disease, COPD, or pulmonary fibrosis. In a healthy lung, the airways and alveoli, tiny air sacs, allow oxygen to pass into the blood and carbon dioxide to be expelled. Damage to the lung tissue or airways can lead to obstruction, inflammation, or scarring, all of which impede this gas exchange process. When the body detects a lack of oxygen or an excess of carbon dioxide, it responds by increasing the breathing rate to compensate. This increased effort to breathe can create the sensation of being short of breath. Number 2. Chronic cough. In chronic bronchitis, which is a form of COPD, the airways become inflamed and produce excessive mucus. This mucus needs to be cleared from the lungs, and coughing is the body's way of doing that. However, because the condition is chronic, the inflammation and mucus production do not go away, resulting in a persistent cough. Similarly, lung damage from smoking or environmental pollutants can irritate the airways and cause ongoing inflammation. The damaged tissues and airways continuously attempt to clear out irritants, leading to a chronic cough. In conditions like asthma, the airways are hyperresponsive and inflamed, often narrowing and producing more mucus in response to triggers. This can cause a persistent cough as the body tries to clear the mucus and open the airways. Number 3. Fatigue. Fatigue is closely related to lung damage because the lungs play a critical role in oxygenating the blood and removing carbon dioxide, both of which are essential for energy production and overall bodily function. When the lungs are damaged, their efficiency in these processes is compromised, leading to reduced oxygen levels in the blood, hypoxemia, and an accumulation of carbon dioxide, hypercapnia. This directly impacts energy levels and can lead to a feeling of constant tiredness. Lung damage can result from various conditions such as chronic obstructive pulmonary disease, COPD, pulmonary fibrosis, and emphysema, all of which impair the lungs' ability to exchange gases efficiently. When the lungs can't effectively oxygenate the blood, the body's cells and tissues receive less oxygen. Since oxygen is crucial for cellular metabolism and energy production, a shortage of it means the body's cells can't produce energy as efficiently, leading to fatigue. Additionally, the body often compensates for impaired lung function by increasing the breathing rate and using more accessory muscles to help with breathing. This extra effort requires more energy, which can quickly deplete the body's reserves, leaving a person feeling fatigued. The increased work of breathing is especially noticeable in chronic lung conditions, where patients often feel exhausted after minimal exertion. Number 4. Unexplained weight loss. Unexplained weight loss can be closely related to lung damage due to several interconnected factors involving metabolism, appetite, and overall bodily stress. When the lungs are damaged, they often struggle to provide sufficient oxygen to the body. This can lead to a cascade of effects that ultimately result in weight loss. One primary reason for weight loss in the context of lung damage is the increased metabolic demand. The body has to work harder to breathe, especially in chronic lung conditions like COPD or pulmonary fibrosis. This increased effort to draw in air and expel carbon dioxide requires more energy, leading to higher caloric expenditure. As a result, even without changes in diet, a person may lose weight because their body is burning more calories just to maintain basic respiratory functions. Additionally, lung damage often comes with systemic inflammation and the release of inflammatory cytokines. These molecules can alter metabolism and lead to muscle wasting, known as cachexia. Inflammatory cytokines can also affect the hypothalamus in the brain, which regulates hunger and appetite, often leading to reduced food intake. Number 5, chest pain. Chest pain can be intricately linked to lung damage due to a variety of underlying mechanisms that involve the structures and functions of the lungs and surrounding areas. When the lungs are damaged, whether by chronic disease, infection, or other conditions, the resultant changes can directly or indirectly cause chest pain. One common cause of chest pain associated with lung damage is inflammation of the lining of the lungs, known as pleurisy or pleuritis. The pleura are 2 thin layers of tissue surrounding the lungs and lining the chest cavity. When these layers become inflamed, often due to infections like pneumonia or conditions like pulmonary embolism, it can lead to sharp, stabbing chest pain that worsens with breathing, coughing, or sneezing. This pain occurs because the inflamed pleural surfaces rub against each other as the lungs expand and contract. Number 6, coughing up blood. Coughing up blood, medically known as hemoptysis, is often directly related to lung damage because it signifies that there is bleeding somewhere within the respiratory tract. This can be a sign of a serious underlying condition affecting the lungs or airways. One common cause of coughing up blood is chronic bronchitis, a condition often associated with smoking or prolonged exposure to irritants. In chronic bronchitis, the airways become inflamed and thickened, and the mucous membranes lining the airways can become damaged and prone to bleeding, especially when irritated by persistent coughing. Another significant cause is bronchiectasis, a condition characterized by permanent enlargement of parts of the airways of the lung. This enlargement leads to mucus accumulation, frequent infections, and chronic inflammation. The fragile, dilated blood vessels in the bronchiectatic areas can easily rupture, leading to bleeding. Number 7, chest tightness. Chest tightness is often related to lung damage because of how lung conditions affect the airways, lung tissues, and the mechanics of breathing. This sensation can arise from several underlying mechanisms, all connected to compromised lung function. Chest tightness is asthma, a chronic inflammatory disease of the airways. In asthma, exposure to triggers such as allergens, exercise, or irritants causes the airways to narrow, swell, and produce excess mucus. This results in a feeling of tightness in the chest as the airways constrict, making it difficult to breathe. The muscles around the airways tighten up, bronchospasm, further exacerbating this sensation. Lung infections such as pneumonia can cause chest tightness as well. Pneumonia involves inflammation and infection of the lung tissue, which leads to fluid and pus filling the alveoli, air sacs. Number 8, mucus production. Mucus production is intricately related to lung damage as both a symptom and a response mechanism. The lungs and airways naturally produce mucus to trap and expel dust, pathogens, and other particles that enter the respiratory system. However, when the lungs are damaged, this process becomes dysregulated, leading to excessive mucus production. In conditions like chronic obstructive pulmonary disease, COPD, chronic bronchitis is characterized by persistent inflammation of the bronchial tubes. This inflammation stimulates the goblet cells and submucosal glands within the airways to produce more mucus. The excessive mucus acts as a defense mechanism, trying to trap and remove irritants and pathogens, but it also clogs the airways. The narrowed and mucus-filled airways make it difficult to breathe and cause frequent coughing as the body attempts to clear the blockage. Asthma, another common respiratory condition, also involves increased mucus production. Asthmatic airways are hypersensitive and react strongly to triggers such as allergens, smoke, or cold air. This reaction causes the airways to become inflamed and narrow, with the mucus glands secreting more mucus as a protective measure. The excess mucus contributes to airway obstruction, leading to symptoms like wheezing, coughing, and shortness of breath. Number 9. Frequent respiratory infections. Frequent respiratory infections are closely related to lung damage because compromised lung function and structural changes in the respiratory system make the lungs more susceptible to infections. When the lungs are damaged, their ability to defend against pathogens is weakened, leading to a higher incidence of infections. This inflammation damages the cilia, tiny hair-like structures that line the respiratory tract and help sweep away mucus and pathogens. When the cilia are damaged or impaired, Mucus and infectious agents are not effectively cleared from the lungs, creating a favorable environment for bacteria and viruses to thrive. This makes individuals with COPD more prone to frequent respiratory infections, such as bronchitis and pneumonia. In cases of bronchiectasis, the airways become permanently widened and scarred due to repeated infections or other underlying conditions. The damaged airways produce excessive mucus, which accumulates and becomes difficult to clear. This stagnant mucus serves as a breeding ground for bacteria, leading to recurrent infections. Each infection causes further damage to the airway walls, perpetuating a cycle of infection and lung damage. Number 10. Wheezing. When someone experiences wheezing during an infection, it often indicates that their airways are narrowed or obstructed, making it difficult for air to move in and out of the lungs. This narrowing can be due to inflammation, excess mucus production, or constriction of the airway muscles. During an infection, such as a respiratory tract infection or pneumonia, the body's immune response kicks in to fight off the invading pathogens. This immune response can lead to inflammation in the lungs, which in turn can cause the airways to become swollen and narrower than usual. Repeated or prolonged episodes of wheezing and respiratory infections can contribute to lung damage over time. The constant inflammation and constriction of the airways can lead to structural changes in the lungs, such as remodeling of the airway walls, scarring, fibrosis, and loss of elasticity. Number 11. Hoarseness. Hoarseness can be related to lung damage through a few different mechanisms. One of the primary connections is the involvement of the respiratory system in producing sound. When we speak, air from the lungs passes through the vocal cords, causing them to vibrate and produce sound. Any disruption in the airflow due to lung issues can affect the quality of our voice. Some medications used to treat lung conditions or associated symptoms can have side effects that affect the voice. For instance, certain inhalers or medications for managing lung inflammation may cause hoarseness as a side effect, highlighting the most critical signs of lung damage that should never be ignored, emphasizing the urgency of seeking medical help. If you experience sudden and unexplained breathing difficulties, severe chest pain, or coughing up blood, don't hesitate to seek urgent medical care. These symptoms could be indicative of a serious underlying lung condition that requires immediate intervention. Your health should always be a top priority, so don't delay in getting the necessary medical assistance. Lung damage can also result from conditions like gastroesophageal reflux disease, GERD, or aspiration, where stomach acid or food particles enter the airways. Chronic exposure to stomach acid can irritate the vocal cords and lead to hoarseness. Although less common, nerve damage or compression near the lungs or in the neck area can affect vocal cord function and lead to hoarseness. This can occur due to injuries, tumors, or neurological conditions. In summary, being aware of the 13 signs of severe lung damage is crucial for maintaining good respiratory health. Early detection and prompt treatment can make a significant difference in managing lung conditions effectively. Remember, your lungs play a vital role in your overall well-being, so prioritize their health by recognizing the warning signs and taking proactive steps towards better lung health. If you recognize any of the signs discussed today, don't hesitate to seek medical advice promptly. You can also check out my other video that talks about 8 signs your body tells you. You might have a heart disease. Your health is priceless, so take care of it by being proactive about your lung health. And if you found this information valuable, make sure to subscribe to our channel for more insightful health-related content.